talk about prescription generally. This is what the chart looks like. Usually you'll be given a patient's information that would contain the hospital number. So you will need to fill it in, the surname, the first name, the date of birth, the weight. If any allergy is given, make sure you write the allergy and the reaction. Then you would see the name of the consultant as well. So if they want you to write it, you will be giving the name of the consultant. Then what ward, what department is the consultant? Then the date the chart itself is written, okay? So you will need to fill out, again, all this information would have been printed out. Now, there are some medication that the patient needs to take only once. So for those, you will fill it in, okay? So you will fill the dates. So let's, for example, they said give your patient 1 dose of, let's say, dexamethasone, right? Then they said you should give it intramuscular, and then they said you should give maybe, let's just say, 12 milligram, okay? So that you write the dates of your exam, the time, so you can just write the clock. Then the name of the drug. Now, they always emphasize that the names of drugs should be written in block letters, okay? So you need to write the name of the drug in block letters. So here we're going to write, so let's assume again, we're doing dexamethasone. So we will do that, dexamethasone, okay? And please spell it correctly, okay? So this is one of those places where your spelling matters. The dose, you would write the dose, the space is not containing. Then the route, if it's IM, intramuscular, you would write that as well. So you write intramuscular. Then again, in the right boxes, okay? Please, in the right boxes. So the name in capital letters. So the name in capital letters, the dose 12 milligram, the route intramuscular, then you will sign your name, this is doctor's signature, and then write your name. You don't need to fill this time. This one is filled by the person giving the medication. So your task is from this box to this box. Okay. So we need to mute some of the. Yes. So the thing is, yes, somebody asked a question. BNF, you're going to have a BNF in the prescription station. There are 2 BNFs, which is going to be the digital one. So it's on an iPad, and then you're going to have the book. Obviously, it's easier to check the iPad because you can just type the name of the drug and you would get the information that you're looking for. Print name, write your full name. So you can put like Dr. maybe S and your last name. Like you can initialize your first name and then put your last name. So Dr. whatever, and then your last name. But if you don't want to put doctor, that works too. Now you see the part that says antibiotics. Again, it's only antibiotics you're going to prescribe here and nothing else. Only antibiotics. So, for example, if they say give clarithromycin or give metronidazole or give penicillin, then that's what you're going to do. Sometimes for antibiotics, they don't give you the dose, so you have to open your BNF. Then in the BNF, you will check the dose. They will tell you, again, the prompt will tell you what you're giving the antibiotic for. So, for example, they can say, give doxycycline for community-acquired pneumonia. So that means you open doxycycline and then you check the page on community-acquired pneumonia. Then you would write the dose. Don't forget your route. Don't forget the start date, which would be the exam date. Then don't forget to sign your name. After signing, write your name in full, okay? So Dr. S, whatever, okay? Then indication, what is the drug for? So again, community-acquired pneumonia, write it. Expected duration, give for 7 days, give for 5 days, give for 10 days. You write that. Now, how many times a day is the patient taking the doxycycline? If you're not comfortable with this dose interval, change it. So you can come here. Let's say you want to give it 3 times a day. And you want to give it at 6 o'clock, the next dose at 2 o'clock, and then the next dose at 10 o'clock. So you can just come here and write your 06, 14, and then you write your 22. Okay, so you can always write yours. Or if you're okay with the time, just click, and click. Okay. Then the year, so please don't forget the year. So 2023, then you would write November. So 7, 11, 8, 11, 9, 11, 10, 11, 12, 11. 13/11, 14/11, 15/11 till the end, or whenever. Then if you're done with, let's say it's for 5 days, so if it's 5 days, one, so we're going to write our something here, so our date, so the day and the month, the day and the month, the day and the month. So let's say it's for 5 days, then what do? We are going to cross out the remaining days, okay? Now, some people argue about the way to cross. I don't really think it matters in my humble opinion. So some people say you can cancel like this, okay? Some people also say, so let me clear all drawings again. Some people say you can cancel this way. The important thing is you've canceled the box and everybody knows they should not write anything here, okay? So that means you're giving it for 5 days. All right. Sorry. Okay. So if you come down here again, it's the same. If you have to give oxygen, I don't know about writing oxygen, so hopefully you guys don't get oxygen. But I mean, the information is here. So let's assume it's our patient that has COPD. So what is the date? Well, the date is going to be, let's say, is the 7th of November. So 7/9/23. What is the device? The venturi mask. What is the concentration? 24%. What is the flow? 2 liters per minute. What is our target? 88 to 92. Then we sign and then we write our name. So if we're to give oxygen, we just fill in the details essentially. Okay. Then regular prescriptions as well. Right? Patient surname, patient's first name, patient's hospital number, and date of birth. So again, let's say a patient is hypertensive, then patient is on amlodipine. So we'll write the amlodipine again in capital letters with a black pen. Okay. I don't think I'm able to pick a black color. Oh, I can pick black. Okay. So amlo in capital letters. Okay. So amlodipine. Please make sure you spell it properly. The dose. So what dose of amlodipine? So let's say it's 10 milligram. We'll write 10 mg. Okay. The routes would be PO, so we'll write our PO. Okay, then we'll sign our name, the start date, the signature. So we'll sign our name. If your signature is long, just have a signature for exam purpose, please. Just develop an exam signature, okay, if you have a long signature. Then print your name. So then indication, hypertension, okay? You don't need to put a stop date here. You can even see there's no stop date here, it's just start date. Somebody said, I think you can write everything in capital letters if it's more comfortable. It's just for some of us, like small letters are like, it's faster to write. However, the medication is the only thing that emphasis is on in terms of it has to be capital letters. All right, so that's it for that. And in some cases, I think in some previous years, they actually had to take history for prescription. Okay, so they had to take a history as well for prescription. So the history was like, so you ask the patient, what medication are you taking? Again, I made the old PowerPoint, it's so annoying. So what medication are you taking? How long have you been taking it for? Who prescribed it for you? How many times a day do you need to take it for? Then you ask them, have they noticed any side effects from using the medication? What condition is the medication for? So just the regular, questions, any challenges with taking the medication. If they're not compliant, you find out why. And you ask them, besides this medication, is there any other medication you're taking, including over-the-counter or supplements, because of drug interaction, okay? So you need to ask all those questions as well. Okay, so these are the things that you would ask if you need to take a history. Then common drug interactions. So the very famous one is clarithromycin and what?
Statins.
And statins, right? So that's the famous one. Clarithromycin and statins. But you also know you can give clarithromycin as well with warfarin. Okay. Then another one is your blood thinner, your anticoagulants like apixaban and aspirin. Okay. Another is methotrexate and folic acid. You cannot give them on the same day. Okay. Yes. Then another thing is make sure if they say patient is allergic to a medication, make sure you check that the medication is not prescribed. This is the information. So I try to create something, not exactly, but at least to get a gist of the prescription, just in case you get something like that. So they already gave us information that Smithsonian Peter, born the 12th of February, 1986, came in today. We need to probably has an infection, and he was prescribed the following medications. They also told us that the patient was allergic to penicillin. So now they said we should check the medication, check the dosage, just check and see if anything is wrong with the prescription. Or if you have a BNF by chance, please open it. Let's start from the beginning now. So let's assume, so please make sure on exam day, actually you'll be given a paper and then the prescription. So make sure you confirm that the name is correct, the surname and the name is correct. So make sure that the chart you're looking at is for the right patient. Okay. All right, so make sure you check then the consultant's name, the allergies. So again, make sure that you check. So now let's go to the medication. What do you notice about the medication? The first one. Who wants to, or one person?
It's written in
The spelling is wrong.
The spelling is wrong, yes.
And it's not written in cap lock.
It's not written in capital letters, yes.
The dose
The dose.
should be 500.
Yes, exactly. That's it, right? The dose is equally wrong. So you see that I did all of that intentionally. Okay, so you have to check. Don't assume that what is there is what is correct. Okay, so you have to check. In terms of the 3 times a day, maybe the timing as well, the interval, and so you have to make sure. So if they say something is 2 times a day, they should be at least 12 hours apart. Okay, and if something is 3 times a day, then they should be 8 hours apart. So you need to pay attention to this one. Okay, so the timing. So if this was 8 o'clock, the next time should actually be 16, and then the next time should be midnight. Okay, so yeah. So let's go to the next one.
So sorry, how do you correct that?
Yes, go ahead, please.
So how do you correct that? Where should you write the?
No, you're not correcting.
No, okay, you're just verbalize it.
Yes, exactly. You're just telling the examiner that, oh, the dose is wrong, oh, the timing is wrong, oh, this is, yeah. So you're just correcting the information. You're not really doing anything in that station, which is why I think is a station that is actually easy to pass.
Sorry, excuse me. How do you know that the timing is wrong?
Yeah, for Thursday.
Oh,
How do you know that the timing is wrong? Sorry.
yes. So you know that if you're giving a medication 3 times a day, there should be at least 8 hours interval. So see, if you even look at the BNF, it says every 8 hours. But from 8 till 5, this is not 8 hours. It's more than 8 hours. This is almost 9 hours.
Oh, okay. I see. Thank you so much.
Yes. And between year and year also you have 5 hours. So the timing is also not correct. Yes, they fill the prescription already. They already did that. All you have to do is to detect the errors in the prescription. Okay. So you're just detecting the errors in the prescription. I hope you guys have not forgotten all the relevant patient information above. Now this cephalexin, what do you think about it? The next one.
Shouldn't be given.
Patient is allergic.
Allergic to penicillin.
Thank you. Thank you. That is it. Make sure you look at all the sheets. Now, because this is computer, we are scrolling. But I think that in the exam, they printed the prescriptions front and back. So make sure you check every paper that you're given. Make sure you check every sheet. I didn't realize it was front and back. I thought that it was just 1 per page. So I looked at the first page and there were 2 prescriptions there, which I corrected. Then I looked again, I didn't see it. Yes, why cephalexin is cephalosporin? If you notice, I intentionally made this allergic anaphylaxis. If your patient has anaphylaxis to penicillin, they should not take penicillin or cephalosporins. However, if the allergy was rash, then maybe the patient can take the cephalosporin. But I intentionally said it was anaphylaxis. Yes, thank you. All right, so good job to the doctors that caught it. But yeah, so first thing is the patient should not have been given the cephalexin. Then another thing is that it was even written wrongly. It's supposed to be in terms of the timing, they only chose evening instead of twice a day. Okay, at least. Yeah. All right, then this last medication.
Timing.
The timing, thank you. Right. So it should be given once a day, right? That's it. But instead we gave it twice. Yeah, we gave it twice. The dose is right, the route is right, but we gave it twice. I actually did another one, but again, I'm not sure what happened to today's prescription, but I did another prescription chart like this where I prescribed clarithromycin in the antibiotic page, and then I gave my patient atorvastatin in the regular page. Okay, but I cannot find it, but I did take my time to edit the drug chart. Okay, but so yeah, so just in case, we don't know which format will come out for you guys, but I hope it's something that you are able to, to get through, and it's easy. But I would say practice both, just practice both, like checking errors. Again, you know what to pay attention to. Pay attention to the dosage, the name of the drug, the timing. Check your allergies. Check all the papers. Look front and back, each of the papers given to you. Or the interaction checker. Oh, so if it was also amlodipine, then I'll just check the drug I want to check the interaction for. Interesting. Yeah, so an exam, so you know what to look out for now, right? So that's what you're looking out for right here.
Mm-hmm.
Yeah. So that means if you want to check interaction, for example, you want to check clarithromycin. So that means first you would type clarithromycin, right? So you tap clarithromycin, then you will click the triangle up. Then you will now check the interaction you're looking for. Statins, like simvastatin. Okay, so it tells you one interaction between these two drugs. So you type the names of the two drugs, and then it tells you the interaction. Yeah, so you type the two drugs, and then it will give you the results. So let me just do it again just to be sure. So clarithromycin, the triangle up. Okay, then yes, and simvastatin. Then it will give me, so I'll click on the yellow, and then it will give me the, however, you can practice writing as well, just to get the gist of writing in capital letter, the dose, the route, the start date, signing your name. So you can just practice. So just practice that, time yourself, 8 minutes, and see how far you can go. It's very good to print it out before time.